Hey guys, welcome to my new podcast series, Your Health You Care. Hello everybody, welcome to my podcast series, Your Health You Care. Today I have the opportunity to talk to you about Guillain Barr syndrome. This is not a new disease. This has been there for quite some time, but lately in the news, it's making headlines, especially in Pune, Maharashtra, where there is an outbreak about this GBS Guillain Barr syndrome. More than 100 patients have been diagnosed, and they are under supervision and under treatment. Essentially, this GPS is not something that medical field is not aware of. It involves the peripheral neuropathy, meaning you see your upper limb and lower limb. They have the neural network connections. They talk with the brain. With every touch, sensation, vibration, any kind of sensations in and out. I mean, the incoming signals and outgoing signals, they are being transmitted through brain. That's how you are able to perform the day-to-day activity, being your hand being used and your feet and legs being used in terms of motor activity and movement. But the infrastructure involving these transmission are essential for day-to-day activity. What I mean to say is the neural pathways. In this disease, GBS, Guillain Barr syndrome, the pathway is somewhat affected. Meaning there is a bug, the bacteria, they enter our body through the fecal-oral route, or let's say through the food that we eat. It could be from vegetables to the non-vegetarian food, and most likely they are coming from the non-vegetarian sources like poultry, eggs and all of that. And once they enter your body through mouth and stomach, they somehow circulate in the blood, and eventually they end up hitting the neural pathways that I was talking about. Meaning, this is the brain control center, and then we have small neurons which travel across the body, and they transmit all kind of signals and activities. So if the bug is going and sticking at a point where they can hinder the neural pathways, then you have some kind of paralysis-like situation, but not exactly complete paralysis, but at least it can lead to some weakness in using your extremities. And what gets tricky in this scenario is there are multiple differential diagnosis in this disease, not necessarily the Guillain Barr syndrome caused by the bug, but also in some scrub typhus cases you have similar scenarios. In peripheral neuropathy due to diabetes, manifestation can also present with the similar symptoms. There are head injuries with intracranial bleeding, or any kind of central nervous system damage can also present these kind of scenario. So peripheral neuropathy is a big term, and that could be manifested due to some other organ failures also. However, in this outbreak, it's been already determined that it is happening due to the neural pathway damage with the bug, which is C. jejuni, and the source of this bug is the food, and not proper handling of the food. So at the end of the day, the hygiene is coming into the play. So far, I think it's restricted to certain geographical areas, but India is very crowded country, so fingers crossed. Let's see if they're able to control and limit these spread, or keep watching the news and looking at the headlines, see what happens. For the precautions, I can recommend, make sure you are not handling the poultry and non-vegetarian food in a light manner. You should be serious about it. Maintain proper hygiene, and if possible, do not access them as of now, and keep your hygiene clean in terms of food processing, and the more responsibilities upon the food handling businesses, where you have wholesale kind of production is going on. But again, if you are bringing it home, at least take your precautions and maintain proper hygiene and cleaning and sterilizing and pasteurizing. Yes, dairy products can also transmit milk, and these can also transmit this C. jejuni and lead to Guillain-Barr syndrome. Guillain-Barr syndrome is often diagnosed in the clinic settings. It's not like it's a surprising diagnosis for the clinicians. These have been diagnosed every now and then, very commonly. But outbreak suggests that you have multiple number of cases happening, meaning some kind of irregularities or mishandling is involved. Just you be aware and maintain proper hygiene. You should be fine. Patient may be essentially presenting with the extremities weakness and numbness and not able to use their extremities properly, considering no other clinical history or diagnosed history of any degenerative neurological disorder. Then you determine that it's happening because of the jejuni. Diagnosis is also easy. So if you have this kind of sensations, and especially if you're traveling in those epidemic hit areas, Pune for example, then you should consult your neurologist, your general physician, and get the diagnosis done as soon as possible. And do not panic about it. Once the diagnosis is established, controlling this and treating this with antibiotic and other measures are not so difficult as of now, but be careful. All the best, take care, and